السلام عليكم ورحمة الله وبركاته. My name is AlMuhaya. I'm a clinical specialist at Joint Clinic. أعتذر عن الحضور اليوم بسبب حالتي الصحية، وأشكر جمعية العمود الفقري على استضافتنا اليوم. My topic is about patient preference for spine surgical and non-surgical management. At the beginning, we need to have an overview about the current status of spinal care. We have, if we talk about the spine in general, and spine care in general, the impact that we have with our patient today, disorder that causing pain, limited mobility, or neurological deficit, and that actually have a burden on healthcare system and economy due to cost. The chronic pain for the spine in general, affecting daily activity and psychological well-being. So the necessity of patient-centered care to address multifaceted needs will give you a message about the overview about our current state of spinal care. For the prevalence of spine-related condition and impact on patient lives, as a spine pain, it could be due to degenerative disc disease, spine stenosis, herniation, etc. And that result in persistence pain, limited mobility, severe neurological deficit, and that will have a healthcare cost and productivity loss, will have also an impact on daily activity and psychological well-being, as we mentioned before. So that's why we need to recognize for more effective and empathetic spine care. If you go to Global Spine Care Initiative, they have the 8 model of care principle. And if you look to the person with spine care need, it's inside as a micro, it's inside the healthcare provider team, inside the community, inside the healthcare system and infrastructure. So we need to focus on person-centered model, biopsychological model, proactive care, also evidence-based practice. We need to have a collaboration among provider and other. We have to have also people-centered care, focus on need and community, integrate healthcare delivery links, resources and system combines together. And finally, self-sustained spine program is supported system-wide that will help the person with spine care need. For the options, we have surgical options, of course, either any type of surgical options, spinal fusion, laminectomy, discectomy, etc. And for that surgical options, of course, we have pain relief as a benefit, improve mobility, reduce nerve compression. For sure, we have some risks such as infection, blood clots, nerve damage, lack of improvement, etc. However, varying success rate post-surgery regarding pain reduction, functionalities, it's different from patient to another. The other side is non-surgical options. We have physical therapy, either with strengthening muscle, improve flexibility, reduce pain with either of pain management tools. We have the tablets, NSAID or non-steroid or muscle relaxing. We have injection also, and they recognize as beneficial in relieving chronic back pain. Maybe with the lifestyle modifications such as weight management, have complementary therapies such as acupuncture, chiropractor, osteopath care. So the bottom line of that is non-surgical approach have good impact on pain, improve function, and prevent issues. However, if we have a patient in the clinic and before we give them an approach, either we can send them back to a doctor for surgical operation or surgical options, or they can use the non-surgical approach. We need to know what the patient expect. And according to Camper, they said that the results show that more than 90% of patients expect a physical examination, test, or investigation. 90% of patients were also hoping for reassurance, advice, and clear explanation of causation. And that's important, trying to find a symptomatic structure through provocation maneuver that we did with it in the clinic. So before we ask about the preference, we need to make sure that we cover patient expectation. That will help us to choose the right preference for the patient. For patient preference, patient actually, they have some preference variants, and they actually matter due to some factors. For preference, of course, either non-surgical or surgical intervention. The factors such as treatment goals, lifestyle, emotional well-being, and personal circumstance, and that will have an impact on their desire and expectation and their treatment choice. And also that will lead to influence on treatment adherence, outcomes, and treatment satisfaction. Okay, if we understand that, we need to know now what's the diversity for the patient preference and the need for personalized cares. And that's actually have some factors such as importance of engagement patients in shared decision-making, tailoring treatment plans based on individual preference for better outcomes, reducing post-treatment dissatisfaction through personalized care approach, and acknowledging variability in preference crucial in shaping treatment choice. So these preference have factor influencing on it, either physical consideration or emotional and psychological factor or socio-cultural influence. For the physical consideration, maybe the pain severity, guide preference for specific spine treatment, function limitation, impact on choice between surgical and non-surgical intervention, quality of life metrics critical in shaping patient preference. For the emotions such as fear of surgical risk, anxiety and treatment success expectation, and maybe they will ask for a quick solution or exhausting non-surgical option. So one of the reasons is that I want a quick solution, so they will go for patient operation, or maybe they don't have to tolerate for non-surgical option, especially if they have chronic pain and it will take longer time. For socio-cultural influence, such as family support, social support, cultural beliefs, and financial consideration, which is now taking a big part of the plan of treatment, especially if patients have no insurance nowadays. So these factors influencing our patient preference regard choosing treatment, either surgical or non-surgical. For take-home message, again, we need to consider patient preference, either physical, emotional, and social cultural factors. Shared decision-making empowers patient and enhance patient-provider relationship. Surgical and non-surgical option both present benefits, risk, and outcomes. Align treatment, balance evidence with patient goals and individual circumstance. Healthcare professionals are urged to prioritize patient preferences spinal care. So the take-home message is placing patient preference at the front always need to call for an action. Thank you so much.